Now, I'm sure you've heard about IBS, but have you heard about a condition called SIBO? What? SIBO stands for Small Intestinal Bacterial Overgrowth. This actually may be the main reason why you're suffering from chronic intestinal issues. Well, in this video today, we're going to discuss what exactly is SIBO. We'll review what is it, how do we diagnose it, what are the causes of SIBO, and at the very end of the video, I'm gonna give you my tips on what I recommend, both dietary options and medical options to get rid of SIBO. Guys, let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru, trying to give you the best tips and tricks so you can live your best life from the top all the way down to the bottom. If you haven't already, don't forget to smash that like button, like, share, and subscribe. If you haven't already, don't forget to subscribe to my newsletter where you can get great tips and tricks like you're learning in today's video. So if you're one of those individuals who suffers from chronic gastrointestinal conditions, bloating, nausea, diarrhea, even constipation, and no one can figure out why, the reason you may be having your issues is a condition called SIBO, Small Intestinal Bacterial Overgrowth. So what this is an overgrowth of bad bacteria in your small intestine that can cause symptoms of pain, bloating, distension, nausea, vomiting, diarrhea, and constipation. What we think is going on is that there is a predominance of bad bacteria inside your GI tract. Your gut microbiome is out of whack, and that's a medical definition. Normally, you have a balance between the good guys and the bad guys, but sometimes there are conditions which lead the bad guys to overproliferate and cause more bad bacteria, leading to fermentation, gas, which in turn leads to the condition called Small Intestinal Bacterial Overgrowth, or SIBO. Now, there are a lot of reasons why you may be having SIBO. For some individuals, it could be an anatomical predisposition. Maybe you've had prior gastric surgery. Maybe you've had adhesions, or a gastric bypass, or a blind limb, or a blind loop. These conditions, or anatomical conditions, can make it more likely for bugs to sit there and ferment to produce gas, almost like a puddle of water sitting outside. It's the exact same scenario. But you may have a medical condition that can predispose you to have SIBO, whether it's diabetes, gastroparesis, scleroderma, or slow gastric motility. Maybe you take antibiotics, or maybe you took some antibiotics that totally wiped out your good guys and really destroyed your gut microbiome. Or maybe you had a gastroenteritis or food poisoning, and that messed up everything going on inside your GI tract to make it more likely for you to develop bad bacteria inside your gut. Now, if you're wondering if you have SIBO, there are a couple different ways that we can diagnose this. One is clinically. Yes, I can talk to you. Yes, me as a doctor actually talking to you. That's amazing, but that's what we do. But we can talk to you, get your history, and understand what symptoms that you're having. Do you suffer from bloating, gas, distension? Do you have symptoms that are consistent with SIBO? And if you do, we can empirically treat you to see how you feel, and your clinical response to that would confirm or deny the diagnosis of SIBO. For some people, we can actually do what's called an upper endoscopy or an EGD, where we go down the small intestine, take fluid samples from your small intestine, look at it under the microscope to see if there's a predominance of bad bacteria. And for others, we can have it breathe into a machine called a breath test, which we can see if you actually have predominance of bad bacteria. These are three different ways we can diagnose somebody with small intestinal bacterial overgrowth. Now, there's one important thing I'll have to make sure you guys understand. There's so much out there on the internet blaming all sorts of conditions on SIBO. I know a lot of people are proposing different crazy treatments, different options, and blaming SIBO for everything. And here's the thing you need to know is that, in my opinion, right now, we don't have a lot of good evidence that SIBO is a cause for a tremendous amount of gut conditions. Now, there are certain individuals in which we do know it does affect, especially if you have IBS. But there are other conditions in which we don't know. And there may be people out there who have maybe more nefarious reasons why they want you to be diagnosed with SIBO. Then you get down this vicious cycle, people thinking they have SIBO, not feeling better, try different treatments, try different options, try different supplements, and nothing seems to work because they actually may not have this condition. So make sure, if you're wondering if you have SIBO or you want to be tested, that you actually get tested by a medical professional. I am 100% convinced this is the best way for you to know what's going on. An even better way to get diagnosed is to see a gastroenterologist who takes care of this every single day. So now that we talked about SIBO, how do we treat this? Well, the first thing we have to do is we have to fix the underlying cause. SIBO can be a chronic condition that can come and go and relapse. Now, one of the things we try to do is fix the underlying cause. Do you have a medical condition that predisposes you to SIBO? Let's see if we can treat that. Do you have an anatomical reason why you have SIBO? Let's see if we can fix that. Do you have a slow motility of your gut? Let's see if we can fix that. These are ways that we can do to help fix what's going on and to make sure you do or do not have SIBO. Number 2 is that we can also give medications for SIBO. In fact, there is an antibiotic that we use that's gut specific to get rid of the bad bacteria. It's called rifaximin or Xifaxan. Now, unfortunately, this is not FDA approved yet to treat SIBO, so sometimes it can be hard to get the treatments for this, but this works effectively for patients who have SIBO. Now, there may be other antibiotics you can use to help eliminate the bad bacteria, but these medications tend to be the best option. Number 2 is natural therapy or herbal therapy. Now, I'll tell you, I'm gonna stress this, we don't have a lot of good evidence for this. There are some herbal therapies that do work for some individuals, and there are others that don't. If you want more information on that, comment down below and let me know. I can do a video specific for that. Then number 3, there's dietary options as well. One of the best diets we have found to treat SIBO is a low FODMAP diet. FODMAPs are fermentable oligosaccharides, monosaccharides, disaccharides, and polyols, which can tend to ferment, produce a lot of gas, and cause a lot of dissension as well. What we found is that diet that's low in FODMAPs can help minimize or eliminate SIBO symptoms, and in fact even can help control IBS. Now, not everyone responds to this, so make sure you do this under the supervision of nutritionists because it can be hard. Now, another diet that works is called a biphasic diet. Now, this diet consists of 2 phases, hence the word bi. The first phase is a low carbohydrate, high fat diet. The next phase is a high fiber, moderate carbohydrate diet. Now, this diet is supposed to help treat SIBO and promote gut health. Now, we don't have a lot of evidence to confirm this actually helps out when it comes to SIBO, but it is a diet worth trying. Then another diet is called a GAPS diet. This is a diet that's based on the premise that SIBO is due to leaky gut. Now, once again, we don't have that much evidence behind this diet, but I've had patients tell me they've responded to having this diet and it helps out. So here's my call to action for you. If you're wondering if you have SIBO or if you're suffering from symptoms that are similar to SIBO, come see someone like me who can diagnose you accurately and maybe put you on a better treatment plan than seeing someone who may not specialize in this particular condition. Guys, I thank you for watching. If you haven't already, don't forget to smash that like button, like, share, and subscribe. And if you haven't already, don't forget to subscribe to my channel where you get great tips and tricks like you're learning in today's video. Guys, I thank you for watching. Don't forget, let's talk about poop. Thanks, everybody.